Prior to inserting any peripheral intravenous cannula, complete a risk assessment to confirm that it is clinically indicated. Refer to the DRIP criteria for guidance. Make sure that you are bare below the elbows when working in the clinical area. Maintain patient privacy during all clinical procedures. Remember to introduce yourself to the patient.
My name is Veza.
Before touching the patient, perform hand hygiene, confirm patient's identification and obtain consent. Whenever possible, select the patient's non-dominant arm. Make the patient comfortable during the procedure. Using detergent wipes, clean the surface of the trolley. Remember to clean the inside of the kidney dish. Perform hand hygiene. Open the insertion pack and place all items on the top of the trolley. Before throwing the packet in the bin, stick the blue insertion sticker onto your clothing for completion of documentation at the end of the procedure. If taking blood, include blood sampling equipment with your cannula and sterile gloves. Place items in the kidney dish on the bottom of the trolley. Apply the tourniquet and select an appropriate vein. Remember to loosen the tourniquet whilst preparing the insertion site.
Thank you.
If required, ask the ward staff for the hair clipper, as this is not a standard item on the IV trolley. Using the chlorhexidine swab stick, thoroughly clean the insertion site using concentric circles from inside to out. Clean an area at least the size of the dressing. Allow to air dry. Perform hand hygiene and open the sterile field pack using a non-touch technique. Place gloves in the front of the field for ease of access. Add all sterile items to the field. Retighten tourniquet, perform hand hygiene and don sterile gloves, ensuring sterile field is not contaminated. Place the backing sheet from the sterile gloves over the tourniquet to enable releasing the tourniquet without contaminating your gloves. Prime the pre-filled saline syringe and remove the cap to expel any air. Peel off the backing from the dressing. Place the sterile bluey distal to the insertion site. Remove the extension set cap for ease of connection once the cannula is inserted. Prime the extension set with sterile saline if blood sampling is not required. Only palpate cleaned skin. Anchor vein and insert cannula. Do not contaminate key parts. Once the cannula is in situ, withdraw needle and ensure safety lock is activated. If blood samples are not required, the tourniquet can be released at this point using the paper from the sterile gloves. Whilst occluding the vein, disconnect the stylet from the cannula and place in the yellow dish or sharps container and connect the extension set.
Taking blood.
Using the sterile syringe, obtain blood samples as indicated. Place the blood-filled syringe on the sterile field.
I'm going to
After blood sampling, release the tourniquet, ensuring your sterile gloves are not contaminated. Apply the transparent dressing, ensuring the insertion site is clearly visible. Pinch the dressing firmly around the cannula hub and extension set. Cross the wings of the dressing under the cannula and peel away the frame. Scrub the hub of the extension set with the chlorhexidine swab. Using pre-filled saline, flush the extension set using a push-pause technique. Close the slide clamp prior to disconnecting the syringe to prevent blood returning into the cannula.
disconnected. Then
Place the securing tape across the extension set and hub connection. Using the Vacutainer blood transfer device, transfer blood into the appropriate tubes and place samples into the kidney dish. Discard the sharps and transfer device into the sharps container and place all rubbish into the bin.
and lift your arm up.
Remove your gloves and perform hand hygiene. Write the date of insertion on the documentation insertion tape from the dressing frame. Place it on the side of the dressing. Do not cover the insertion site. Complete the blue sticker and place it in the patient integrated notes. The medical team are to review the need for the cannula daily. IV cannulas are to be removed if no longer clinically indicated. Refer to the drip criteria. Provide the patient with the information leaflet included in the PIVC pack.